Good day, viewers. Eko Blog is reporting live at Ayobo, Lagos for Eko Club International's 2024 free medical mission outreach, starting with the Ayobo community. The medical mission is set to feature donations of medical equipment, supplies, and free medical checkups as lab cleaning service and Polakwa Waters host Eko Club International. Eko Club International is a community-based organization of Lagosians in the diaspora, established to foster cooperation and unity among its members and empower each other politically, socially, and economically, with the primary aim to contribute positively to the advancement of the prosperity of Lagos State. So stay tuned as Eko Blog brings to you all the live update of the events as it unfolds. I am Daniel Samson Idowu, reporting for Eko Hot Blog. Just as human needs and desires are limitless, so is the effort to meet the demands of all individuals in the society, particularly the underserved and the struggling members of the community. On Saturday, November the 1st, 2024, Eko Club International launched its 2024 Medical Mission Outreach in Ayobo, Lagos, to supplement the Nigerian government's efforts, particularly those of the Lagos State government, in providing quality health care. Eko Club International is a community-based organization of Lagosians in the diaspora, founded to foster cooperation and unity among its members while empowering them politically, socially, and economically, with a primary goal of positively contributing to the advancement and prosperity of Lagos State. The ECI Medical Mission is a free humanitarian mission established in 2007 by Otumba T.J. Abbas, a prominent Eko Club International leader, which was initially an annual event but was recently rescheduled to be held biannually. This year, Eko Club International's executives, members, and volunteer medical practitioners were hosted by local businesses, lab cleaning services, and Polakwa Waters, who provided logistics support to ensure the outreach's effectiveness and success. Among those attending from the United States were several chapter presidents and key ECI leaders, including Honorable Saheed Olusi, Eko Club International President, Mr. Olajide Damola, Eko Club International Vice President, Honorable Bashir Agoro, President of the ECI Houston Chapter, Honorable Olabisi Dabiri Okoya, President of the ECI Philadelphia Chapter, Dr. Lola Ogbara Alogba, Chairperson of the ECI 2024 Medical Mission, Honorable Olatunji Antonio, ECI's Treasurer, Yeye Bisi Rokosu Lawal, ECI Social Secretary, and Honorable Yetunde Conrad from the ECI Austin Chapter, among many others. The outreach include health education, diabetes screening and intervention, eye screening with free frames, cancer screenings, dental exams, free medications, procedures, surgeries, and general health tests. Widows and elderly attendees also received mini palliative packs containing rice, gari, and seasonings. Throughout the program, organizers and participants of the 2024 Medical Mission expressed appreciation for the outreach.
But you really do well. We enjoyed it and we love it. We embrace it.
Bravo. May God bless them and keep on keeping them. And I pray that they will not relent on this. They will continue, at least for the benefit of the community.
This year's mission, according to Eko Club International's agenda, will cover multiple Lagos localities, including Ayobo, Egbeda, Lagos Island, Ipakodo, and Ejirin, from November the 1st to the 9th of November 2024, with a closing ceremony and award night on November 10th, 2024. The Eko Club International 2024 Medical Mission provided a remarkable experience for Ayobo residents as the mission now moves to its next stop, Egbeda. As the event drew to a close, hosts and benefactors of the event shared their thoughts.
Eko Club International is a conglomerate of about 25 different chapters across the globe that are made up of Lagosians. Currently, we have one active chapter in the UK, we have one active chapter in Canada, and 23 within the United States of America. And these are, again, mostly Lagosians in the diaspora who are professionals in their various fields. And as part of that, that's why we're here on the medical mission. This is something that we started back in the year 2007, and we've been coming home every other year since then. And when we come here, like we do today, it's a show of support, partly for the community, partly for the government. We're showcasing our support principally in healthcare as we give back freely to our communities. This mission, 2024 medical mission, we will be visiting 5 different locations. We're here today at Ayobo, and then tomorrow we'll be going to Lagos Island, and subsequently we'll also be going to Ejinre Kingdom. We'll be going to Ekpakodo, and also we'll be going to Egbeda. Part of what we do is we bring from the diaspora healthcare professionals who are doctors, nurses, lab scientists, and so on and so forth. And when we get here, we partner with our local partners who are also either medical people and logistics people. We also partner with community hosts and community leaders so that we can collaborate on a seamless operation of giving back to the people within the community.
In fact, you really did well. You can see the whole people of Ayobo. What I will have suggest, you will have done it branch by branch, because Ayobo is so wide, even including the Ishefun everywhere. You know, we are so many that I don't think they will be able to attend to everybody, but you really do well. We enjoyed it and we love it. We embrace it. When I get here, I went in for malaria parasites. So they did all the blood pressure, sugar tests. In fact, I did cervical because, you know, I also did, if everything was okay, but the one that I come for, I went for it, the malaria parasite. So they did a check. It's only that pinning that scares, but it was you did very well. The whole test, they even asked me to come back in 30 minutes time, so I'm hanging around so that by that 30 minutes time, I'll go and get the results. Oh, in fact, should I say that is what makes this arrangement to be wonderful? The palliative, the packaging, the palliative were packed for elders, but in fact, you do well because it contains garri, rice, salt, you know, all these things are what we needed. And you know, by the time we are cooking or eating this palliative, we will remember that Eko Club International has done well. More grace to your elbow, you've done well.
In fact, I feel great. I never expected it to be like this. But the way it turned out to be, I'm very, very surprised because they attended to everyone accordingly. They did not do partial or anything. They attended and they follow it line by line, according to your name, no rushing, nothing, just everything just went out smoothly. And the test, in fact, I enjoyed the test. It gives me the opportunity to do my vaginal test, which I've never done for long and I'm afraid of doing it. But here I did it free of charge. And the medication that they gave to us, everything is just free of charge. In fact, bravo. May God bless them and keep on keeping them. And I pray that they will not relent on this. They will continue, at least for the benefit of the community. Many doesn't have money to go to the hospital to take a treatment or go for all these tests that we went to. Like when you want to go to the vaginal test now, we know how much it will cost. But here it's just free of charge. The dentist, the eyes, and I collected even the glass they gave to me. I requested for one medicine, they gave it to me without collecting a dime. It's just a big relief for the community.
Actually, there are a lot of, it's a big turnout. We're impressed, but when we got here, we had to do many things to get it set up. And as I can see, we're moving fast, right? Yes. Actually, they express, many of them that have attended, I'm a nurse by profession, and many of them that I have attended to, they're really appreciative and they're very happy that they have the opportunity, and they are glad that we are here. And so we are impressed. We would love to come back again. You're happy when you are blessed. You are a blessing. You are blessed to be a blessing. Since we are giving back to the community, and people are appreciating, and it's helping their medical, medical. So I think it's a grace for us to have the opportunity to give back to the community.
Turnout is great. I mean, if you look around, there's a lot of people. I don't even know whether we're able to cover the multitude of people that are here today. But the turnout has been great. The community is out. There's a lot of need, and we're helping people as much as we can. And that's the essence of the medical mission, to give back as much as we can to the community, and we're happy to do that. Oh yeah, the turnout has been great. Kudos to Eko Club International. So we have volunteers who left their jobs and their vacation time to come here. So we have people from the United States, people from the UK, people from Canada. I think overall about 50 of us, different professionals, doctors like myself, pharmacists, nurses, dental hygienists. We have some tech people too. Some IT people showed up this year as well. So different people showed up, and there are other people who are not in the healthcare field who just showed up just to help give back. So overall, the turnout has been great, and kudos to everybody from ECI for that.
Yeah, it's really a good initiative. For me, I think it's really going to, for this kind of community, I think it's really going to go a long way, because we have so many people that have so many underlying health, especially when it comes to high blood pressure and sugar level. And most of them, they have this thought of, oh, when I'm going to the hospital, I'm going to spend much. I don't even have money to eat. Where do I get the money to pay for my bills? So with this initiative, at least people were able to come out. They know that, okay, I am getting this for free. This has nothing to do with me spending money. And this is really going to go a long way. It's really good. It's a very good initiative, and I really appreciate the organizers. Thank you so much for this initiative. May God continue to bless you and strengthen you for bringing this opportunity to this environment.
So far, the turnout has been great, although we're expecting actually more than this, because we are used to a huge crowd, but it's still okay, and everything is going as planned. Oh, definitely, medically, they are greatly benefiting from it, because all the medications, everything is brought from abroad, and we have all our specialties here. We have doctors, we have surgeons, we have nurses that are here attending to them. So they are really benefiting from this. And we're also going to continue covering them, because we have a registration, and we're hoping that next time we come, we'll be able to follow up with whatever we do today.
This is Medical Mission 2024. It has been going very, very well. When we started, it was rough, but the people in the area, they are cooperating, and they are wonderful people. We don't have any issue at all. They follow the rules and everything going, how we are expecting it to go. And part of the medical mission today, Dr. Ishola provided palliative, and we have been giving it to the widows, elderly people, and few young people that maybe disabled a little bit, people that have challenges. And it was a very, very nice one. People are happy. It has been advised to them to use their medication and make sure they have food using the medication, so that the medicine can work. And everything has been going on very well. We have over 1,000 people over here. I'm sure over 250 people have been seen. By the end of the day, I'm sure we are going to take care of everybody that was here today. So that is what I have for now. The palliative, I believe, is something that Dr. Ishola added to today's mission. And it has been distributed to the elderly people, widows, and adults that are able to collect, especially people that have little challenges.
Ó wà òkè kódà wọ́n tẹ̀ tí wá help àwọn èèyàn gan tó yẹ pé wọ́n ti ń wá àìmọye àwọn tó ti ń wá opportunity tí wọ́n rí tó dẹ̀ wá àtúnwọ̀n so wọ́n dẹ̀ grab ẹ̀ lẹ́sẹ̀kẹsẹ̀ ó wà òkè gan. Mo complain fún ara ríro tí n bá ti ṣiṣẹ́ during the day ara máa kọ̀ ro mí so wọ́n fún mi lóògùn ara ríro wọ́n dẹ̀ fún mi ní oògùn aràn pẹ̀lú blood tonic tí mo máa lò wọ́n dẹ̀ fọmọ mi náà lóògùn ikọ́ àti multivitamin so mo complain fún wọn.
It's very impressive. So we are happy for the turnout, just about what we are expecting, really, because usually each location depends on the publicity and the involvement of the host. So this year we really get involved with the host, planning, coordinating with them. So we mobilize. So because I'm part of the logistic team for the ECI, so we work hands in hands with their team. So to make this occasion possible this morning. I believe we make a lot of difference. That's why we continue this program. I will tell you something simple. This program started in 2007 under the leadership of President Iji Abbas. So when he came up with the initiative, I wasn't part of the executive, but I was part of his boys then. So we rally around, we make it happen. Since 2007, we've been coming to Lagos every other 2 years. The first 2 years we do year after year, then later we change it because of other programs we have over there in the state. But we see a lot of impact we make within our people, our community, the difference. Even if it is little difference, we know that our people appreciate it. So that inspires our people to donate, to put us together and say, you know what, we should continue this program. And that's why we're here today.
This is Eko Club International Medical Mission. We started this a couple of years ago where the sons of Lagos State come together to impact our community back here at home. It has been very, very successful in the past, and this time as well, as you can see, there is a lot of participants, a lot of people that we have been taking care of. There are professional medical doctors here, medical nurses, and health practitioners. We are here to impact our community, to give back to the community. This is going to benefit the society tremendously because we understand that there are some people that are able to go to the hospital and there are some people that are not able to go to the hospital simply because they cannot afford it. But this will help them to come to see a medical doctor, at least someone to give them assurance of whatever is going on with them and encourage them to go to the hospital so that they can get treated and they don't just die, unreasonably. Yes. This is going to go on for a couple of days. The program will be, I think we are here for about 9 days. We are going to go to different areas of Lagos State to ensure that our outreach program gets to the people that need it most. Yes.
Well, we'll try very well. I'm grateful. But I will all again that they should please go try to gbé mi wá because most of the things that we full gon ari gba beyen. Like for example now, ó torí ojú gangan lè mi fi wá pé maybe I can have the access of ma fi ní glass or treatment for ojú mi, but unfortunately wọ́n ti pack out and wọ́n ti lọ. So that is the only thing I can say for now. They should try. Kó bá wa gbé wá ẹ̀mí because kò easy. I mean, we masses, we are begging that they should please come back again. So if they can help us through that. Most especially, most people here, they need that eyeglass and they need eye treatment. So at least they are retrying and God will bless them for that.
Well, this event happens every 2 years for us. It's biennial. Most of the time, it's self-funded by us, ECI. We do get some help from Lagos State government, but pretty much it's from our donors, from our members actually. So most of the people you see with the hats and the shirts that come from abroad, they pay for their own tickets to come here and they also fund their money. They donate money towards this event. Well, that is humongous. I didn't expect this when we drove up. There were so many people, but usually that's what we tend to see. I mean, it's a joy. It's good. This is what we want. It's an honor for us to come and give back to our community. So, well, one of the things that we always like to bring out is not just the drugs, but is the awareness. So, all of our doctors instruct them that no matter what, still make sure you go back to your local community health center and make sure you continue the checkup, because we may only give them drugs for 1 or 2 or 3 months, but no matter what, you have to continue your checkup. So it's more than just giving the drugs, it's more awareness of your health.
Oh, very impressive, and the people are really happy and delighted to have us here, and we appreciate the host, Dr. Lola Ishola, and other members of Eko Lagosians of Minnesota for doing this for the people. We are very impressed and satisfied with the conduct of the first day and the way it's going. It's okay. Like you rightly said, health is wealth, and this will boost the morale of the people, because having free medical services, drugs, medications, and then checkup and all that. So this is very good, and people will really have good health of making sure that they work hard. Thank you.
Massive and encouraging. We have some little issues of organization, because by the time we got here, there had been some organization on the ground, but the people were so massive that they invaded all the places where the doctors, the nurses would sit down. But we were able to get it arranged, and we commenced, and it's going on smoothly by God's grace. A lot, quite a lot. Most of our people don't really know about themselves. Some blood pressure, some sugar, their glucose level is on the high side. Majority of them don't know. Some had glaucoma, some had cataract, they don't know. They are cleaning their teeth, they are doing everything. We're able to make them understand that they need to take care of their health. And the turnout are very encouraging. They really appreciate it, they know about it, the things are really working well.
Well, indeed, this medical outreach organized by the Eko Club International has touched a lot of persons in the community of Ayobo, and more Lagosians is set to benefit in the coming days. Thank you for staying tuned to Eko Blog. Do not forget to follow us on all our social media handles on Facebook, Instagram, and X at Eko Blog. I am Daniel Samson Idowu, reporting for Eko Hot Blog.